place. Let's take you to Quebec and have a listen in as to what's happening there.
We are also asking those who take food to them to keep 2 meters away from them, to not take advantage of the fact that they're there, to start chatting. You can do that over the phone after. So it's really, really important to keep that distance. The last thing that we want is for people over 70 years of age to catch the virus. So let's keep that in mind. And it's true for Easter. So I'll be the first, I'm used to every year, it's like Mother's Day. At Easter, I would go to my mother's, but now I'm not going to go to my mother's. I'll be calling her on Sunday, of course, but I won't be going to see her. So I want us to mobilize ourselves, all of society, all Quebecers, to do everything to protect our elderly. That should be our priority mission in the upcoming days and weeks. So, the numbers for the day. Unfortunately, 25 new deaths. We are now at 175 deaths. Of course, I wish to offer my condolences to those families of the victims. We have now 10,031 confirmed cases, an increase of 691. 632 people are being hospitalized. That is an increase of 49. And out of those 682, there's 181 people who are in intensive care. So an increase of only 17. And I wish to tell you, yes, I have to cough in my elbow. I'm sorry, next time. I wish to tell you that it's been a few days that we've been seeing that it's really stabilizing in terms of hospitalizations. That really, truly is good news. That means that we are starting to see the light at the end of the tunnel. We are starting to, if it continues this way, we are starting to win that fight that we're waging, which is encouraging, and which brings us to start preparing the next steps, that is the reopening of stores and businesses. But I just want to tell you, we're not there yet. We still have to keep seeing these kinds of days as we've had in the past few days, when there's no big increases in the number of hospitalizations and a number of people in intensive care, which does not prevent us from preparing ourselves. And I wish to perhaps talk to entrepreneurs, to owners, to managers of businesses, to explain to you the discussions that we are having with public health. So first, of course, when we reopen businesses, it will be very important, first of all, to concentrate on those businesses where people really can. And here, I make a call out to the responsibility of owners and managers to remain 2 meters away. Employees have to be able to, at all times, being 2 meters away from their colleagues and 2 meters away, if that is the case as well, from clients. That is going to be a very important criteria. And the 2 meters, get used to it in Quebec. That's going to last months. So in the next few days, next few weeks, we're thinking about reopening businesses, but the guideline for the 2 meters will remain for months. So get used to that guideline. Of course, as well, when we're thinking of reopening businesses and stores, well, of course, that also will have an effect on daycare. Of course, it's difficult to respect the 2 meters in schools and in daycare, so we have to ask ourselves questions. If we want workers to go back to work, well, what happens with the children? What is going to happen with public transportation and rush hour? So we're going to be asking, in the next few days, we'll ask employers to see how we could be more flexible with schedules so that not all workers use public transportation during rush hour, in the morning and at the end of the afternoon, because we don't want, of course, for people to be all in a bunch in the trains and metros and buses. So it's just to show you that it's not that simple. I'm seeing certain comments of people who are saying, well, all businesses that are 2 meters away should all be reopened tomorrow morning. Yeah, okay, what are you going to do with the kids? What are you going to do with the employees who need to use public transport? We have to take precautions. So yes, I'm optimistic, that we'll be able to, in the next few days and weeks, to start reopening businesses and stores. But we have to be prudent, and we must make a call out to the responsibility and accountability of employers. And the numbers have to continue stabilizing. And for those numbers to continue stabilizing, we have to keep working hard. I know that we're asking a lot of Quebecers, but it is important to remain disciplined. I wish to now get back to the scenarios that were presented yesterday by the experts of public health. For me, there's two data there that is very reassuring. First of all, the projections on the number of hospitalizations and the number of people who would be in intensive care depending on the different scenarios. You saw that in intensive care, in the most pessimistic of scenarios, which is that of an Italian style or a little bit like what happened in Spain, we would need 1,000 beds with ventilators in intensive care. And that, if it's necessary, we have it. We don't believe that it will be necessary, but we have that capacity of having 1,000 beds with ventilators if the pessimistic scenario were the one to take place. So that is very good news that we got yesterday during the presentation. The second good news that we got in the data that was presented yesterday is to see that up until now, our scenario, that of Quebec, is a lot closer to that of the best countries, such as Germany, as opposed to the countries where there were more deaths. And that this is due to Quebecers respecting guidelines. So I think that we can be proud of the results that we've had up until now, while saying, let's not stop. We started really well. We are heading the right way. The daily thanks. I wish to give those thanks to all those people who are working in CHSLDs and the residences for the elderly, whether it be doctors, nurses, attendants. I know that the situation is hard, and I just want to tell you first, courage. Reinforcements are coming. And I also wish to say thank you so much for your devotion in circumstances that are very difficult in CHSLDs and residences for the elderly. So a very special thank you today to all those who work in those residences. And I'd like to end by perhaps concentrating on the 2-meter guideline, because each Quebecer is going to have to visualize themselves in the next few weeks and months of always staying 2 meters away from other people. So, of course, this is a new culture. So, we can't shake hands, we can't be too close to other people. So let's try all together to start visualizing this. That for a certain number of months, this is how it's going to be. We're going to be staying 2 meters away from other people. So I would like to conclude by saying the last few days' data make me optimistic. We're starting to see the light at the end of the tunnel. We are starting to win that fight together. I'm very proud of the work that has been done by Quebecers who have been unified since the beginning. We just have to keep working hard to make sure that we can start getting out of
All right,
this
just want to
crisis.
bring you an update on what the Premier
And
has
that we
said.
can
25 new deaths in Quebec, in the province of Quebec, bringing the total to 170.